Whether you're recovering from an accident, illness, or required nursing of any kind, Family Care Visiting Nurse and Home Care Agency provides services in the comfort of your own home. Joining us today is Ruth Ann Crusetto, the Supervisor of Clinical Services, and Dr. Mark Wilczynski, an orthopedic surgeon at Orthopedic Sports Medicine. It's great to have you both here.
Thank you.
Ruth Ann, first of all, we've talked about Visiting Care Nurses Association before, so let's refresh people's thoughts about it. What exactly do you do?
We take care of any patients that are referred to us, no matter of their payer source or their physical condition. They could be diabetic, they could have cardiac problems, orthopedic problems, surgical procedures. We're all able to do everything.
And how many locations do you have?
We have 5.
All right.
5 locations.
And the number of communities you serve?
We service all the way from, I'm going to say from Fairfield all the way through Clinton, all the way down the shoreline.
We're talking about a large area here.
Yes, yes.
That's great. Now,
Yes.
Dr. Wilczynski, what's interesting about you is that you have also been a patient as well as, of course, a clinician. So how did you benefit from this type of service?
Well, I've been doing knee replacements for years, and a few months ago, I was no longer the physician, I was the patient. I had my knee replaced a few months ago. So over the years, the information I would gather and the experience I gathered from patients was basically from patients, but it wasn't firsthand. So when I became a patient, I learned a lot. I learned what patients go through, what to expect, and how to get through it.
And what did you experience?
Well, the surgery part of it, I know the surgery part of it from doing it, but post-operatively I experienced physical therapy in the hospital, but then when I went home, I decided to go home, by the way, rather than go someplace to a rehab facility, and I had family care come in for mainly nursing care, and the main thing they did was physical therapy. I had excellent physical therapy.
Now, you talked about how from now on, now you see the benefits of rehab at home instead of going to a rehab center.
Yeah, in certain circumstances, you have to have the right patient. If the patient is relatively healthy, and if they have good family support, then they could benefit from going home rather than to rehab. I think it's better to be in your own environment. When I had my treatment at home with family care, the therapist came in every day, and she worked with me hour and a half. She tortured me for an hour and a half. And it worked out great.
It was a good torture,
It was a good
right?
torture.
Okay.
No pain, no gain kind of thing. So
Exactly.
I had a good experience with it.
Ruth Ann, do you have doctors like Dr. Wilczynski who actually recommend that their patients seek out your type of service?
Absolutely. We have some orthopedic surgeons that prefer their patients to go home rather than to go to rehab. Many do much better at home. The recuperation period is much shorter, and they're in their own family environment. They have the support of their family and their loved ones, and that we all work as a team together.
All right, so what should they expect? We heard a little bit from Dr. Wilczynski, but what does your staff do?
Our staff will go in. Our nursing department will go in. They'll check the PTINR for the Coumadin level, report that immediately to the physician. That's all done in the home, so the patient does not have to go out to the lab. And rather than a venous draw, it's just a finger stick prick, and we have results within 4 minutes. And we work closely with the doctor, with the family. We are able to take out sutures and staples, so that eliminates one more visit out to the physician.
You say you work closely with physicians like Dr. Wilczynski, but Dr. Wilczynski, since you were a patient as well, do you think that because you had a knee replacement that you were an ideal candidate for this type of service?
Oh, I was, because I'm basically healthy, and I'm active, and I really knew what to expect. So I knew what to expect from the therapy. I had visiting nurses come in to check my wound, although I could check my own wound. But I had them do that, and they did their services. But the main thing that helped me with family care, I had an excellent physical therapist. And I had my surgery done in the middle of all the storms this winter. And in spite of the storms, my therapist trudged down. We have a long driveway. She trudged down the driveway, I don't know how many times, when we couldn't get it plowed. And she was really good, and I really appreciated what she did.
What other types of surgery would make certain patients more ideal for this type of service?
Well, hip replacement surgery is another very common operation we do. Fracture surgery also is, it just depends on, again, the patient and how healthy or debilitated the patient is. So you have to have the right patient. Not all patients are perfect candidates for this, but even if somebody goes to a rehab facility after surgery, we always use healthcare agencies to go into the house. And typically, if somebody went to a rehab facility, say after a total knee replacement, they would get their initial therapy there. They'd come home, and then the home health care therapy would kick in, and they would go through the same thing I went. I just bypassed the rehab part of it.
And Ruth Ann, actually the service starts very early. It's before surgery as well. What do you do when you go to a person's home
to do a
before
pre-op
the surgery?
visit,
The pre-op
right?
visit.
The physician would call us and let us know that a certain patient is interested in going directly home, and we would go out, nurse and or therapist, to make sure that the home is suitable. The bedroom and bathroom have to be within reach. If the patient's not able to walk the stairs yet, we need to make sure that those facilities and durable medical equipment, everything is on the first floor for them. You know, how many steps to get into the front door? Are you going to be able to exit if there's a fire?
So you're moving around furniture as well?
We will do it all. We will, you know, work with the family to assist us in doing that. We will order equipment preoperatively to make sure that they have everything they need by the time they return home.
Great. Now, if you want more information on family care, visiting nurse, and home care agency, you can call this 800 line, 1-800-946-6331, or visit familycarevn.com. Thank you both for being here.
Thank you.
Great information.